Hello, my name's Lucy Khalidi and I'm one of the head and neck clinical nurse specialists at Princess Alexandra Hospital. I've worked for about 12 years looking after patients going through chemotherapy, and one of the worst side effects that they complain of during their treatment is fatigue. So today I'm going to talk to you a little bit about fatigue and how to manage it during and after treatment. Fatigue is a feeling that can be described as having little or no energy all or most of the time. It's not like normal tiredness that can go away. It doesn't seem to go away regardless of how much sleep or rest you get, and it can affect you physically, psychologically and emotionally. It can be quite overwhelming and hard to cope with, and unfortunately can last a long time, and sometimes it can last several months after treatment has finished. There are many reasons why you may be experiencing feelings of fatigue. At different points in our lives, we may feel more tired than usual and need more rest, but there are specific factors related to cancer which may be causing these feelings. Firstly, the impact of being diagnosed with cancer can cause feelings of being overwhelmed, unable to cope, and of fatigue. During the period of being diagnosed, it's an extremely worrying time. There is a lot of uncertainty, a lot of upheaval with attending hospital appointments, scans, and having biopsies. Some of these investigations can't be done locally at Princess Alexandra, so there is travelling involved, and the financial burden of taking time off work and using public transport to get to appointments can be quite difficult to manage. There is then a lot of anxiety related to what the outcome will be of these hospital visits, and then finally, when you are diagnosed, the stress and anxiety of starting treatment, the worry of telling family and friends, and the side effects of treatment can all add to feelings of exhaustion. One of the patients that I looked after recently described being diagnosed with cancer as being on a roller coaster. She felt as though she was being strapped in and didn't know what to expect, knowing there was nothing she could do about it and that it was all out of her control, until she emerged wobbly and battered at the other end. Once you've been diagnosed with cancer, treatment starts very quickly afterwards, leaving very little time to come to terms with what you've been told or to prepare for treatment to start. Many cancer treatments can also cause fatigue, including chemotherapy and radiotherapy. One of the most common side effects of chemotherapy is fatigue, and about 90% of our patients who have received chemotherapy mentioned this as a side effect through their course of treatment. Chemo can impact on a patient's ability to retain information and think clearly or concentrate for long. Some people refer to this as chemo brain. This is quite a flippant term for something that can be quite debilitating and challenging. Chemotherapy can also cause anemia by killing red blood cells. So not only does it kill the cancer cells, it also kills some of your healthy blood cells. Being anemic can cause tiredness and lethargy, as you don't have as many red blood cells to carry around oxygen, leaving you feeling weak and short of breath. One of the other treatments that can cause fatigue is radiotherapy. Although this treatment is targeted and shouldn't alter your blood results, it can be very time-consuming due to the frequency of visits to hospital and the distance patients have to travel to get treatment. Our head and neck patients usually travel every day for 6 weeks, Monday to Friday, to the North Middlesex Hospital for treatment, as radiotherapy is not given at Harlow. So the options for patients are either to travel to the North Middlesex in Edmonton or Addenbrooke's in Cambridge. Fatigue can also persist after treatment has finished, which can be very frustrating. Lastly, with the causes of fatigue, there are lifestyle factors to take into consideration. This can result from physical exertion or lack of physical exertion, lack of sleep, being overweight, periods of emotional stress, grief, using alcohol or drugs, poor diet and other health conditions including thyroid problems, diabetes and autoimmune disorders. Within the subject of fatigue, we can look at the boom and bust cycle. When you're struggling with fatigue, it's really easy to get into habits that may not be beneficial. The way we feel about the fatigue and the impact it may have on our lives can mean we push ourselves too hard. Over time, this means we have less energy. The boom and bust cycle explains this. The temptation to push ourselves when we have more energy means that we can burn ourselves out, and this then leads to us needing more time to rest and recover. As this cycle continues, the amount we can do gets less and the time it takes to recover gets longer. Try to find a level of activity you can manage that does not cause excessive levels of fatigue. Your fatigue level will still fluctuate, but by trying to avoid overactivity or excessive rest, it stays in a more stable range. When trying to cope with fatigue, one of the most beneficial things you can do is undertake some form of exercise. This can cause the body to release chemicals called endorphins. These trigger a positive feeling in the body and boost your mood. Although exercising may be the last thing you feel like doing when you are overly tired, low intensity, planned, short bursts of exercise may well help. Short walks, practicing Pilates, yoga or Tai Chi have all been found to be helpful in combating cancer-related fatigue. There is a lot of research suggesting yoga is particularly helpful, especially as it concentrates on breathing techniques and uses gentle movements. Eating and drinking well and keeping healthy can help you to regain strength and have more energy. Some people find their tastes change after treatment or that they lose quite a lot of muscle mass, so it can be challenging to try and make sure you get all the nutrients you need. It's important to try new foods and to take advantage of when your appetite is good. And it's also extremely important to drink plenty of fluids through and after treatment. Getting enough sleep is also important to help combat fatigue. Try to go to bed at around the same time every night and get up about the same time. Try to stick to a relaxing bedtime routine. Sometimes a warm bath and a hot milky drink can help. Avoid large meals, sugary foods and drinking caffeine or alcohol close to bedtime. It's also important to make your sleep environment as relaxing as possible. Another helpful way to cope may be by keeping a fatigue diary. By writing down when your energy levels are high or low, you can identify what might be causing this and plan your days accordingly. You can also write down your blood results on this if you have regular blood tests and other information that you might find helpful. A fatigue diary is available in the Macmillan Fatigue Handbook, and it can be a useful guide to linking when your energy levels are higher or lower to planning daily activities. If you are really struggling with fatigue and nothing seems to be helping, it can lead to depression and feelings of anxiety. Talking to someone through counselling might help, and counselling services are available through the Helen Rollason Cancer Charity. There is also community support available too. Our local hospices, St Clair's and Isabel's, both have programmes run by their day units for fatigue management. They usually meet once a week and run for 6 to 8 weeks, and these are usually held either at the hospice or at day centres in the area. If you are an existing member of a gym, it's worth asking if they have specialist programmes to help combat fatigue, especially after recovering from an illness. Some fitness trainers are specially trained in fatigue management. Healthy Minds is a free service available to anyone who is having trouble coping. It's a free counselling service run by the NHS where patients refer themselves. This can be done by phone, self-referral form from the GP or an e-form which can be found online. The Macmillan Hope course is also very helpful for patients who have received treatment for cancer who are still having trouble coping with side effects. Lastly, local charities in the area may be able to help. Helen Rollason, as mentioned earlier, provides care in this region for anyone who has been affected by cancer, and they provide counselling support and complementary therapies and are now based at the Leisure Zone in Harlow. It's also really important to look after yourself if you are a carer for someone with fatigue. Fatigue can be difficult for both of you to manage. If you organise your partner's hospital appointments, it may be helpful to use their fatigue diary to highlight the best times of day for them to attend. It can also help to talk to other carers in a support group or an online chat forum. Action for Family Carers offers stress reduction techniques, reflexology and head and neck massage for carers across Essex. Fatigue is a challenging side effect to deal with as there aren't any quick fixes or medication to take, but hopefully by using the strategies that I've spoken about, you can reduce your tiredness and start to live a more active life. There is always support available at the end of the phone from Macmillan.